what do I say after that? Phenomenal, just phenomenal story, and so touching that it's really hard for me to even get up here and say anything after that. You are a very strong man with a wonderful family. But I am going to say something because Howard knows I can't keep my mouth shut. I am not going to talk to you about Skin of Steel. If you want to find out about Skin of Steel, www.skinofsteel.org. That's not what I'm here to do today. I'm really here to talk about being a patient. You are my people. And I need to do a quick survey, and if you don't feel like participating, that's fine. I hear about HIPAA laws every time I have to go into a doctor's clinic, but if I have a better sense of who's in the audience, then I'll be able to, as we say, personalize or customize what I say, just like with treatment. So I'd like to get an understanding of how many people are actually patients in here. Okay. And again, you don't have to respond if you don't want to, okay? That's my HIPAA thing. And how many people are at stage 1? 2, 3, and 4? Okay, that tells me a lot too. Okay, thanks for the information. So I want to first off thank Tim Turnerman, the Melanoma Research Foundation, for having the wherewithal to come to Chicago and to help us think this through a little bit more. And after Tim, I have to, he doesn't remember, but I was his first patient at Rush. I have to thank Howard Kaufman. Howard and I have, I've had the honor and pleasure of being his patient and being able to talk to a doctor who speaks English, and the English that I understand, which is really helpful. And I would be really remiss if I didn't talk about his other half, which is Jill Titsey. And Jill has been pretty much the soldier at the front, making sure that I was taken well care of in many different ways. And I feel very close to both of them and very, very lucky that they're in my lives. Okay, so before I really start this, I have to go ahead. I have to set a disclaimer. Okay, I'm 52 years old. All right, so I have some problems here. So I'm going to warn you that I'm 52 years old. I have now one 20-year-old and one 18-year-old. And the reason I was late today, and I want you two to hear this, the reason I was late today was because I was taking my oldest on her last college tour. And when I first got diagnosed in March 23rd of 2005, my hope was I would see my youngest graduate from 8th grade. She was at the time in 5th grade, and I thought, will I make it? And so here I am, and I'm now taking my youngest to look at colleges. The other thing that happens when you start becoming a clinical trial patient for a number of times is that sooner or later, you, if you're female, may be thrust into immediate menopause. And that's another reason why I kind of don't remember some things. And for any husbands who are here or friends of patients who are female, these drugs and trials can put a perimenopausal woman into menopause very quick, and it is like jumping off a cliff, and we are very difficult. So give us 3 months and we'll become normal again. But these were all unknowns to me. Yes, we do treat melanoma with chemo. There's all this conversation about do we use it, do we not use it, so on and so forth. Howard has guided me through that, as well as his another med-onc, and I can't remember his name from Rush, that Dr. Bonomi. And I've had had that experience. I will say, of all the experiences that you'll see that I've had, chemo was probably the most snide in that it zapped me. It zapped me of my energy, and I didn't see it coming. So as we all have been humbled here in this room, I too have been humbled a number of times, but chemo kind of caught me off guard. The other reason why I need a disclaimer is because I have read way too many consent forms. And I now am probably a speed reader of consent forms. So it just comes with the territory. Okay, so who am I really? Well, I had to sit down and think, what was I going to tell you guys? Because I refuse to be defined by this cancer. That is not who I am. I am a wife. There's my husband pre-menopause when my hair was red. And then my daughter is down there. My son is over there. We were able to actually celebrate my husband's 60th birthday. He's Japanese. The Japanese have a really good tradition. When you hit 60, you really rewind the clock and you start from 1 again. So he feels very young these days. I also very much am a clinical trial patient, and I am going to really advocate for that because, in all honesty, there's not one of you in this room who's not a scout for melanoma. We are the trailblazers. There's enough expertise, and I'm going to make a strong argument for clinical trials. Warning. The other thing is you're going to find out that I've walked out of 3 brain surgeries. And after the 3rd one, I'm kind of going out, and Jill's there, and Howard's there, and I'm trying to figure out why in God's name am I still here? And I guess there's a reason, and I better get to figuring out that reason, and I guess it's because I'm supposed to push the cause and the research and the awareness ahead. And so with my advocate team, who is composed of 6 people for me and 6 people for my children and my mother and my husband, they need to be taken care of as well. And because I've been at this since 2005, I know that I have to distribute the help, so to speak, so I don't wear anyone out. And so consequently, I started an organization called Skin of Steel. I still run a industrial and commercial real estate firm in Chicago, but as Jill and Howard know, I spent a lot of time bugging them about where we're going with the research. And I've also subsequently gone public, and because I've gone public, my suburb has become aware. And so while the organization focuses on research and awareness, most of the awareness is done by a local team, and that's been really thrilling to watch in terms of people getting educated. Okay, now. All right, but what you really want to know about, beside the fact that I've just defined who I am as a human being, is now who am I as a patient? And so I'm going to take you through this very quickly, and if you have questions afterwards, I will hang around because I know this is a really long day, and you guys have been trying to digest a lot of information. Just like Tom Gajewski was talking about from University of Chicago, I was one of the first peptide vaccine phase 2 patients or trial participants with the National Cancer Institute. And that was my first move I made when I was diagnosed as a 3B. That's how I started this game, 3B. Fun. And I made the decision to go to NCI. Again, I had an advocate team who could support me, but I also had 2 young children, and I had to make the decision, and I know that for those of you who have children, this is very, very difficult, because you're not sure how long you're going to live, especially in the beginning. And so what happens is you're trying to figure out, do I go to a trial? If I have to leave Chicago, do I go to a trial? Or do I raise my kids? Or how do I do both? And I can tell you that I remember the taxi was in the driveway, and I was sitting at the table, the kitchen table, and my mother had come in from Florida to take care of the kids, and my husband was putting my luggage into the cab, and I had a complete and utter meltdown. Why am I going to NCI? I'm going to be a guinea pig. They may kill me, yada, 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 yada. And my mother said, she just looked me in the eye and she said, "Get over it, honey. You don't have a choice. You got those 2 kids, and you have to fight for your life. And you and I understand that, and you, too, understand that very well." And in a way, it's a blessing because they remind me each and every day of why you do not give up ever. So 2005-06, I am basically doing this with NCI because I'll be damned if my kids are going to get hit with this disease and we're not going to have an answer. Forget me. I'm after trying to make sure that my kids are not going to have to go through this. And so I decided to participate in a peptide vaccine. I've got 16 vaccines in this leg, kind of looks like a mogul hill. It obviously was good for research, but did not help me. So in May of 2007, 6 months after I completed the 16 vaccines, I got hit with inguinal nodes and required surgery. And so that was in May of 2007. By August 15th of 2007, 3 months, metastatic disease. And we're not talking about metastatic disease. We're talking about metastatic disease that can cause an NCI doctor to start crying in front of me. She had all she could do to contain herself because she just couldn't believe that this thing could fire up. And all of you in this room know that we're dealing with one of the most genetically complex diseases and one of the most erratic diseases. And if it wants to take bloom and fire, it will. And so there I was with a substantial amount of melanoma in my liver, my spleen, and lungs. So it was a threefer. So what do? They take a tumor out and they say, "Hey, we're going to try to put you on an antigen therapy. And so we need this tumor and we're going to work with it. And basically what we grow is going to have to multiply by 50% in order for us to be able to use it." And so, and it's going to take, I think it was going to take a month and a half, 2 months, so on and so forth. So there I am with melanoma on fire, and we're talking about 2 months of waiting, and they say, "Yeah, I guess we don't want to do that. So we're going to grow your cells, but at the same time, we're going to do IL-2. I am sure there are many opinions about IL-2 in this room. I am sure there are many opinions about interferon. And the only thing I can say to you is each person's experience is unique, and there is a difference in how it's delivered. And we are blessed to have a doc who knows how to use IL-2 very well. And that is Howard, and he's not going to admit to it, but I'm going to tell you he does know what he's doing with IL-2, and I can tell you in comparison to the way it was delivered to me at NCI, there is a difference. Who knew? I know now. So I go through a complete cycle of IL-2, and after the second series, we do scans, and not good. Things are not good, and so we realize that we're going to have to go with the big guns. And so I'm with Steve Rosenberg at NCI. He's got the largest melanoma clinic in the world. He's got the best funded melanoma clinic in the world, and these guys work like dogs. I mean, they are constantly with patients. I have a real respect for anyone who's in this field. and I know just how hard they are working. And it's not only the front line in terms of the docs, but what I've learned is it's the nurses, it's the guys in the lab. If you ever get a chance to meet the guys in the lab, go do it, because it humanizes why the heck they're up for 24 hours trying to grow that thing. The guys in the lab. Pathology, another field that is really important. So we do, and again, Tom Gajewski was talking about adoptive T cell, or TIL. That's how it's referred to quite often. And NCI, MD Anderson work a lot with TIL. It's kind of like, there's kind of like different research lines, and some people are involved with, some institutions are really focused on TIL. Other institutions will go immunotherapy, other institutions might go targeted, and other institutions might go a blend of things. So I was involved with TIL. What does that mean? What does TIL mean? TIL means that they are going to basically shut your immune system down. And they load you up with Cytoxin, and they shut that immune system down, and in the meantime, they've done an apheresis where they have pulled out those T cells that they wanted. Hopefully you remember what he was talking about in terms of those T cells. So they pull the T cells out, and they start to, as I say, try to create Ferraris, zoomed up cells that are going to go and find that melanoma. But you got to wait. You got to get the immune system shut down. This all has to be timed very, very carefully. And you have to then let them grow these Ferrari cells. And then what they do is they come in and they say, oh, one other thing. We really like IL-2 because it's like a primer. It's like a fertilizer. It's like a, that's not even a good word, like a flashlight. And it shines on melanoma to a certain extent. At least this was the way it was explained to me at NCI. And so out goes the arm and in goes the IL-2. And I'm going, whoopee, let's try to hang in. But they use a low dose of IL-2. And then what happens is an amazing thing. A 20-something-year-old researcher comes up, and she runs up, actually, from the lab, and in her hand is a pocket, okay, or a unit, and it's golden. And that unit is basically those Ferrari cells that when I saw it in the lab originally 2 weeks prior had been in a bag about this big. And they condense it down, and that's your golden packet. And it is an honor for anyone in that lab to be able to deliver the TIL. And so they that is a badge of accomplishment within the lab to be able to come up and give that packet. And I have to tell you, it's a very emotional thing because you realize how many people have worked so very hard just to get to this moment. So, okay, I've got the IL-2, I've got TIL, and now we wait. And we do not let the immune system kick in, because we're going to go and give it a chance, give those Ferraris a chance to find the melanoma and deal with them. And you guys know the T cells are memory cells and so on and so forth, so if we can at least get on the map, we have a chance of having a multiplier effect. Well, I was down about 30 pounds. Now, normally I'm really always trying to figure out how to get down 30 pounds, but this is not the way to get down 30 pounds. And how do you spend 3 months of your life away from your children in Bethesda, Maryland? Well, what you do is you have an advocate team, and they come in from Chicago, and they check up at you at 3 o'clock in the morning to see if you're okay. They will sit at your bed, and they will spoon feed you brown rice 1 teaspoon at a time, because that's the only thing you can hold down. And you thank your lucky stars that they're in your life. Miraculously, at day 7 or 8, they kick the immune system back in. They allow the immune system to kick in. I can't remember, again, this is chemo brain, I can't remember whether the cytoxin just has a shelf life of a certain amount of days, and the body naturally kicks in with the immune system. But be that as it may, I decide I'm better. And what I do is I pack my bag because I want out. And I leave the bag right in front of the patient room door. So the poor doc has to come in and trip over the bloody bag. But I could not have gotten my message clearer any other way than, please get me home for Thanksgiving, because I have a lot to be thankful for. And in fact, as my other girlfriend came in, my husband's taking care of the kids, my other girlfriend comes in to get me back, to shuttle me back, because I am pretty weak. But here's a funny story. I'm in Reagan National Airport, and my girlfriend hasn't had a meal. And all of a sudden, out of the blue, I decide, Chinese food. Oh my God, I could have Chinese food. I think I want Chinese food. And I start eating again. And what we then realized was that I was on a tumor regression of about 25%. And that was miraculous given what was happening back in August. So now we're in the end of November, December, and things have gotten to the point where I can eat again. My kids see me, and I am a little bit scary, but we are able to celebrate the holidays. And then you have to go back. You always have to go back to NCI for more scans, more tests. How many more tests? Only I'm kind of losing my energy, and something's up. And I know that if I have regression of 30%, they will do the whole thing again right away. And so somewhere in my inner soul, I've got to reserve enough energy. And one thing that you need to take away, if you don't know it already, this is not a sprint. This is a marathon. And you always have to remember, how are you going to preserve your energy? You've got to fight for your energy and hold on to it, because you don't know when you're really going to have to use it. And so I walked into NCI and I found out, oops, you've only regressed 25%, not the required protocol of 30%. And so the diagnosis at that point was, you've got less than 6 months to live. This is January 2008. You've got 6 months to live. Get your stuff together and take care of your kids. And, oh yeah, we've got this drug, Temodar. I don't know if any of you are familiar with Temodar. It crosses the body-brain barrier, but you know, it only works on probably 10% of the population, and maybe for 6 to 9 months if you're lucky. Good luck. Out the door I go. And I believe them. Right? I believe them. So that's what I did. I decided that if there was anything I was going to do, I was going to teach my daughter how to be more generous. She was in 7th grade, and 7th grade is all about me. And I felt if I was going to leave this world, I needed to make sure that this kid knew to be generous. So we worked on different ways to do that. My son was a sophomore in high school, and all I could think of was, oh my gosh, does this kid know how to interview to get into colleges? And does he understand that it's a buy and a sell? You sell yourself, but you're also buying the college. How can I teach him really quick? And he's only 15, and he doesn't even know what an ACT or an SAT is yet. But we went out and started interviewing colleges, and he got it. He started to learn what to do. So now we're into end of February. And my local onc is looking at my numbers, and wouldn't you know it, my LDH is starting to drop. And the other thing is that I keep getting stronger. And I'm taking Temodar. I'm taking Temodar, $3,000 every month. Temodar comes into my house. And at the same time, I'm looking over my shoulder because death is at the door. And I was told by these guys, this is it. And some of you might have more faith than I did. When I got to that point, I didn't think that I was going to make it to the end of the year. And so I would be exercising. I've always exercised a lot. I would be out hiking with my girlfriends, and I'd say, gee, I made it to the 3rd month. And I looked at my girlfriends and I realized that they were getting really tired. And so I said, okay, they're getting tired. We need to do something different. And so a neighbor of mine was a Olympic rower, and I had always wanted her to teach me how to row. And I convinced her if she wasn't going to teach me how to row, she was going to teach my advocate team how to row. And so these 40-something-year-old women started to learn from an Olympic rower how to row an 8-woman boat. Those boats are really heavy, about 400 pounds. And we had to put them on our shoulders and take them down and get them into the lagoon to learn how to do this. Okay. So I set this up, and I'm going to watch my girlfriends. And now we're into April. And they have these tanks that you practice in while it's cold. And I go down to watch them in the tanks. And the coach says, no. If you're here, you're in a seat. Sit down, get the oar in the water. I'm like, you don't understand. I don't have any muscle left, so on and so forth. But I do it. And long story short, by October, I'm very competitive, sports-wise. And by October, we had raced, for those of you who are near here, the New Trier girls B team, freshman B team. And our whole goal was not to lose by more than a minute. And lo and behold, we were able to accomplish that. And doggone it, I wasn't dead. What am I going to do now? What am I going to do? I've worked with my kids, I've worked with my husband, I've got our staff trained, and I'm still here. And the local oncologist is just looking at me saying, I've never seen a melanoma patient do this. I've never seen Temodar work like this. What is it? And that's the question. What is it? Was it Temodar? Was it TIL? Was it IL-2? Was it the peptide vaccine? We don't know. And that's one of my challenges to the medical community is we're getting to the point now where we've got enough patients out there with these funky track records. How can we start looking at what it is that allows these guys to hang on there for as long as some of us are able to do? I'm not sure. For a drug that was supposed to last 6 months, I take a 22-month ride. And I have a very active life. I'm climbing mountains in Colorado. I'm running a business. I'm not doing any patient advocacy at this point, working with my kids, so on and so forth. But then, that one of the most genetically complex and erratic of cancers decides we're going to give her a run for the money. And this time it's brain mets. Oh my God, brain mets. That's the kiss of death. We know that most melanoma patients are going to die of brain mets. And I'm thinking, okay, this is it. I've got brain mets now. And the only thing I can say is that sometimes, and I, by the way, am a patient of almost every melanoma specialist in the city of Chicago. They all claim me, and I have been thankful for all of their input. But sometimes you have to get second opinions and visit with people to see who's the right fit for you now. And there's different institutions that do things differently. I was lucky enough at that time to be Howard's first patient, and this guy turns around on a dime and gets me into brain surgery. It's, let me get this right, Stereotactic Radiosurgery. So, translation, they don't cut your head. What they do is they put a halo in, and then they run 5 arcs into your brain that mirror the shape of the melanoma. And the reason that they do that is because there's a minimal amount of spillage, so to speak, in terms of the radiation, and therefore there is a hopefully minimal amount of damage. Did I get that right? Okay, so we do that, and halos are interesting, but manageable. And then I am met free in the brains. And that was my goal, because I know darn well that it's going to be really difficult to do clinical trials if I've got brain mets. I'm just not going to qualify. And then what happens is Howard says, Susan, what do you think about IL-2? And I'm going, okay, well, I handled it at NCI. It wasn't a walk in the park, but I handled it. I had some problems with my blood pressure. That was my biggest challenge. But, you know, I don't want to go in the ICU, Howard. I really don't want to go in the ICU. And he's saying, no, we don't do it like that. You know, we're able to do it in a regular patient room. And so we start. Now, I will say that Howard was new, and I was new to Rush, and the nurses had not seen IL-2 for 6 years in terms of the melanoma environment. And so together, we collectively learned from each other and got me through this experience. And I have to underscore, there are times that you collaborate as a patient. You really do collaborate. And if it's done with humility and done with the best of intentions, everybody works really well together. We try IL-2 with the intent, again, of priming the body. And I just have to underscore this. We're going to be using IL-2 in a lot of different ways, and particularly when you're starting to understand combo therapies. IL-2 is just going to come up again and again and again. And I take a lot of calls from patients all over the world. And the first thing they'll do is they'll read my story and say, what about IL-2? You know, and I'm thinking, what about brain surgery? IL-2, walk in the park, brain surgery, a little more difficult. But I don't say anything about that. Again, IL-2, depending on each individual, will play out differently. So after IL-2, melanoma came on fire again, and we tried an earlier stage of BRAF, a BRAF inhibitor. Okay, so now we're trying targeted therapy because I am V600E mutation positive. And we try BRAF, and unfortunately, though, we can't get on the latest BRAF. So we're working with an older BRAF, and it's in combination with a chemo cocktail. And we got 5 months out of that. And then I get hit with brain mets again. And it's like, oh, God, 2 times. But this time, there's a radiation oncologist who really is a neck and head specialist. And all I can do is tell you that I didn't come out of it looking like the bride of Frankenstein for the second time. Okay, he is magical, Dr. Diaz, I think. His magical touch, and it's not a walk in the park, but it's doable. It's just got to be doable. And my rule of thumb is, as long as you can't tell me pain is permanent, then all I have to do is get through the next minute. And if I string those minutes together, we'll be done. And I think you probably know what I'm talking about, Jeff. So what we do is have the brain surgery because, again, I'm saying to Howard, I gotta be met free in the brain. My brain mets have to be silent. How do we do this? How do we do this? We do this with brain surgery. And then we have to make a really important decision, and that is, what would be the best treatment for me at this time, given that the melanoma is taking off? And Howard and I have to have a heart-to-heart now, because this is just the lay of the land. Does that particular institution have the trial that you need next? If you sit down and you work with your oncologist and you figure out what is going to be the sequence, the question is, do they have the trial? And sometimes, my rule of thumb is, I can't fall in love with him. Okay, I have to have a professional relationship in terms of patient-doctor relationship, because I also need to be able to go where the drug is. And in this case, the drug happened to be at Lutheran General with John Richards and Siggy Hallmeyer. You heard John Richards speak today. And we started ipilimumab. And ipilimumab, I survived all 4 treatments. Side effects, you've got to be really careful with IPI. Really careful with IPI. Can I say that again? Really careful with IPI. If any of you are walking that walk and you see that you are getting, the keystone here is diarrhea, you got to be talking to your doc. And this is not something that you wait a couple of hours for. And I just have to underscore that over and over for us. Okay, so I get through the 4 treatments, and we take the tests again, and another brain met. So now we're up to the 3rd brain surgery. It's right before Thanksgiving, and it's also right before my eldest is going to come home from college for the very first time. And all I want to do is make Thanksgiving dinner. That's the goal here. Nothing else, just can I make Thanksgiving dinner for him? We have the brain met surgery 2 days before, and then, lo and behold, I can make Thanksgiving dinner. Granted, it wasn't the full thing, but, you know, we had Thanksgiving dinner. Day after Thanksgiving, I get really difficult gastrointestinal pain. Now, I've been trained about IPI, but the first thing that comes to my mind is, oh, Susan, you don't know how to cook a turkey anymore. You just gave yourself food poisoning. And so I wait. And I wait for probably about 2 hours until it occurs to me, no, guys, and this is before we knew this. When you take an immunotherapy, and I should have figured that out way back with TIL, we don't know when it's going to kick in, or if it is kicking in, and we just don't realize it. It may not kick in to the degree that we want, but there could be a certain percentage of kick in. There could be a delayed response, so on and so forth. So the lesson is that we don't know exactly when IPI will kick in, or if it will kick in. And the second lesson is simply that the side effects can be delayed. And they can be, I've talked to people who've had a delay of upwards to 6 months. So these are things that I share with you in terms of being aware of paying attention to the side effects. So finally, in December, so we get through Thanksgiving, it's December, and I decide that we've got to make another stab at this, and I'm hearing about BRAF. Vemurafenib, Zolbetuximab. Okay, I can talk about them in any way, shape, or form. BRAF. Roche Genentech's BRAF is called Zolbetuximab right now. And so the problem is that I know that I'm BRAF positive. We know that we have this more effective drug, but there's no trials that are open. And Howard gave you a very good list of how do I find trials, right? And you go to clinicaltrials.gov. You go to Chicago Melanoma Consortium because Jill is constantly at the docs getting them to post the clinical trials for Chicago. But what I realized is that I may have to go direct to pharma. And if you navigate through a website, you will figure out who the particular team is, and you have a conversation with them, and you ask them what the future is, and you find out that, hey, they're going to have an expanded access trial, but only 3 sites in the country. And guess what? Chicago's not in the mix. And if I leave you with any other thoughts, if you're in an opportunity to ever advance pharma's understanding that Chicago is a place for melanoma treatment, and to pay more attention to us, that is time well spent. I wound up going out to Los Angeles. And I go to Los Angeles, and there I am the first person on the expanded access trial. And what then happens is within 7 days, I've got subcutaneous that are now very visible. Within 7 days, all subcutaneous, with the exception of one melanoma site that was larger than a small football, okay, in my left flank. But all subcutaneous melanoma are melted. I can't say gone because I haven't done a CT, but melted. By day 10, I have a very, very strong reaction to the drug. I get into a feverish state, and I have a full body rash. I think I showed you a picture of that before, just what the face looks like. And we realize that we've got to get off the drug. We've got to stabilize me before we can continue. And what happens is we drop the dosage. We start up again. I get better. We start up again, but with a lower dose. And same thing happens. So now I got 1 shot left at this, because you can only take the dosage down so far. And 3rd time's a charm. For those of you who are women, I would encourage you to pay attention to the fact that sometimes the dosage is not quite right for us. It can be adjusted, but only to a certain extent. Okay, so bottom line is, what we know about BRAF is 5.6 month durability, and that is the big problem with BRAF right now. However, when I took my scans, the first time I took my scans 2 months after start, I was 60% regressed in tumors. The second time I took my scans 2 months after that, it was 65%, and so on and so forth. I'm standing in front of you today, 10 months into this drug. I'm the outlier. You know, when you see those curves and they talk about the tails, for whatever reason, I'm an outlier right now. There, but for the grace of God go I. And I have been Genentech's guinea pig in terms of, and I use that word very, very proudly. I don't have any problem being a guinea pig in terms of the side effects. And so we're finding that there are certain side effects that BRAF can present with, and I guess the most important one I find is great photosensitivity. I don't know if you can see my hand, but by mistake I left it exposed for about 2 minutes, and now I am extremely photosensitive. The other thing that BRAF can present with is uveitis, which is basically a problem in the middle eye, and it affects your vision. So if any of you go on to BRAF and you experience that, you really need to get to an eye specialist, and you need to be talking to your doc. So anyway, I'm now at the point where, and the reason that I was asking the gentleman before, how are we going to get flexible in terms of FDA approval of different profiles, so to speak, for eligibility, is because you can see how many treatments I've had, and I'm a hard sell now because I'm not clean, I'm not pure. I got a bunch of things. In fact, now you can go to the next slide. I am. We often ask, what am I at this point? And when I talk to folks, I often will tell them, well, thank you, because of your taxpayers' dollars. I am, in effect, a multi-million-dollar biochemo experiment known as the Bionic Woman. And that's where we're at this stage. And I have overspoken here, but I hope that you get a sense of the importance of not giving up and the importance of being open to lots of expertise and staying as calm as you can 1 minute at a time. Thank you.